Before we begin with the eruption and shedding, I just wanted you all to recollect the odontogenesis or the stages of tooth development. So, this is the oral epithelium, dental lamina, which connects the enamel organ to the oral epithelium. This is the ectomesenchyme. And because of the interaction between these two, um, the enamel organ takes up different stages based on the direction of the proliferation of the cells, and they're called as bud stage, cap stage, and bell stage because they morphologically resemble those shapes. So let's start with understanding what is the definition of eruption and why do we need to know the eruption timings of teeth. What are the stages of eruption, and of course, followed by summary and multiple choice question. The learning objective for this lesson is that you should be able to enumerate the various phases of tooth eruption, discuss the factors affecting it, and discuss theories of tooth eruption. So, eruption refers to the occlusal movement of the tooth from its developmental position within the jaw until it reaches the functional position in the occlusal plane, that is, when it occludes with the teeth of the opposing arch. And we say occlusal direction because you don't say upwards or downwards, you say occlusal direction because both it applies for both upper and lower arch. And the human dentition is considered as diphodont because there are two sets of dentition in the human life: primary dentition, which lasts from 2 to 6 years of age, and permanent dentition, which kind of starts around 6 years of age, and then after 12 years of age it's just a permanent set of teeth which are present in your mouth. In between, they both are seen together, and that phase is called as mixed dentition period. The initiation of calcification is by 5 months in utero, and all crowns start calcification at this age. By 1 year of old, all crowns complete formation, and by 2.5 years of age, all primary teeth would have erupted into the oral cavity. The root completion happens usually 1.5 to 3 years after the tooth has erupted into the oral cavity. So by 4 years of old, all primary teeth complete root formation. Every 6 months, 4 teeth emerge into the oral cavity. So by 6 months of age, here there is a kind of a duration given, average given 7 to 9 months, but 6 months is the average time when the tooth erupts in the oral cavity. So just for your understanding, I'm going to use every 6 months. So at 6 months, the central incisor erupt both upper and lower, that is 4 teeth, and by 1 year of age, 2 laterals of both upper and lower arch erupt, so that makes up for 8 teeth. By 1.5 year of age, the first molars come, so that makes it total of 12 teeth. And by 24 months or 2 years of age, canines erupt along with the rest of the teeth, and by 2.5 years, all the teeth erupt. So the last tooth to erupt is the second molars. The eruptive movement is classified as pre-eruptive, eruptive, and post-eruptive tooth movement, and this is the physiological tooth movement. So the pre-eruptive phase is made by the tooth germs, both deciduous as well as the permanent, within the jaw. We will see in detail about the pre-eruptive phase later on to understand why the tooth germ has to move within the jaw. The eruptive phase starts with the root formation, and it moves from its position within the bone and to its functional position within the oral cavity. It has both intraosseous and extraosseous phases. So intraosseous is the one which happens within the bone of the jaw, and extraosseous is outside the bone. The post-eruptive phase it takes place after the teeth has reached into its functioning position, and this is usually to accommodate to the growing jaw or to compensate for any kind of occlusal and proximal tooth wear. So pre-eruptive tooth movement is the movement of the tooth germ within the jaw before the teeth even begin to erupt. Why do these crowns move constantly within the jaws? This is to place the tooth in a position within the jaw for the eruptive tooth movement to begin. The deciduous teeth grow rapidly and there are permanent tooth jumps as well, so it gets very crowded within the jaw. The growth of the jaw simultaneously will alleviate some of these problems, and the developing crowns move constantly during this phase because they have to respond to the positional changes of the neighboring teeth as well, or the neighboring tooth gem as well, apart from the changes in the maxilla and mandible as the jaw growth also continues. So let's see the relative position of the primary teeth along with the permanent tooth germ here. So these are incisors, permanent incisor tooth germ, and this is the primary incisor. So initially they will all be at the same level, at the incisor level, but later on the permanent tooth germ moves lingually and is situated at the apical 1/3 of the primary incisor. This is to make sure that the eruptive movement happens in that situation, in that position, sorry. And the permanent premolars are at an occlusal position with your molars, and initially they will be slightly lingually situated, but eventually they will be right underneath the roots of the primary molar. Premolars replace the primary molars, and the permanent molars erupt individually. They're not successional teeth. They do not succeed any existing teeth. They erupt from the distal lamina. Okay, remember that. So this is a premolar tooth germ which goes right underneath the molar, which is the primary first molar and second molar. And what happens to the permanent first, second, and third molar is that in the upper jaw, there is usually a distal rotation. This is the upper. So there is usually a distal rotation of the upper molar. As you can see here, it is totally distally tilted because there is no space for it. But as and when the jaw grows, the tooth will become vertical and then erupt into the oral cavity, as you can see here. Whereas in the lower teeth, they kind of incline mesially. There is a mesial inclination, and later on they become vertical and then erupt into the oral cavity. The remodeling of the bony wall is by both osteoblasts and osteoclasts. Osteoblasts are the cells which are seen at the periphery lining the bone, and these are responsible for the formation of the bone, whereas osteoclasts are situated within the Hauschilp's lacunae, and these are responsible for resorption of the bone. Whereas osteocytes are the cells which get trapped within the bone, and these maintain the homeostasis. The next phase is the eruptive tooth movement. This is the axial or the occlusal movement of the tooth from its developmental position within the jaw to its final position in the occlusal plane. So it has several events which occurs. First is the root formation, and then is the movement, and then penetration, and finally the occlusal contact. So in the root formation, space is required for the developing root, and this pressure or the resistance from the underneath bone is what pushes the tooth upwards. And when it is moving upwards, the tooth is covered by reduced enamel epithelium, and this reduced enamel epithelium fuses with the oral epithelium and becomes a single layer. The tooth will be covered by reduced enamel epithelium, the erupting tooth. That reduced enamel epithelium will fuse with the oral epithelium, and some hydrolytic enzymes are released to lyse that, and eventually the tooth penetrates the oral epithelium. So that's the penetration. And once it enters the oral cavity, it grows or moves occlusally until it reaches in contact with the opposing tooth. So that's the occlusal contact. So histologically also there are several changes which are happening around the erupting tooth, that is in the connective tissue as well as in the bone. All these undergo degeneration to create a eruption pathway for this tooth, and this is facilitated by the macrophage, like I said, by releasing the hydrolytic enzymes. Gubernacular cord, this is the cord. This cord is nothing but the remnant of the dental lamina. It is a strand of the fibrous connective tissue, and this strand of fibrous connective tissue is attached to the dental follicle, which is actually surrounding an erupting tooth. So this acts as a pathway for the eruption of the tooth. So eventually there is a resorption of the bone and the connective tissue around the erupting tooth, and that forms the gubernacular canal. So in skull, you will see these gubernacular canal as holes which are present lingual to the anterior teeth. These are nothing but the openings of the gubernacular cord. This is a histological picture showing a clinical crown. This is a permanent tooth germ, and this dotted line is nothing but the enamel cuticle, which disappears after some time, the eruption of the tooth. So the intraosseous phase, that is all the changes that are happening within the jawbone, occurs at a pace of 1 to 10 micrometer per day, whereas once the tooth erupts into the oral cavity, or the extraosseous phase, the outside the bone, is about 75 micrometer per day, which is quite faster compared to the intraosseous phase. Periodontal ligament has a very important role in eruption. In the beginning, all periodontal ligament fibers are arranged parallel to the tooth surface, and this periodontal ligament has contractile property because of the myofibroblast, which attaches and detaches and hence pushes the tooth into its eruptive pathway. And once the tooth reaches its functional position, the periodontal ligament get attached in their permanent position. As the tooth moves occlusally, there is a space created under the tooth to accommodate this root formation, and some bone is deposited to fill in this space, which is left behind as the tooth erupts in the pattern of a ladder, which can be seen in the radiograph as well. And this gets denser as the tooth erupts. And once the tooth formation is complete, when it reaches the functional occlusion, the periodontal ligament fibers attach to the apical cementum and extend into the adjacent alveolar bony sockets. The post-eruptive tooth movement happens to accommodate for the growth of the jaws to compensate for the occlusal wear as well as the interproximal wear. The formation of new bone at the alveolar crest and the base of the socket occurs between the age group of 14 and 18, and this is to accommodate for the growth spurt or the increasing height of the jaws in human beings. Whereas the compensation for occlusal wear occurs by deposition of the cementum at the apex of the tooth, and interproximal wear is compensated either by mesial drift or by some more deposition of cementum. The theories of tooth eruption says that it is multifactorial. So we'll see four different factors, that is root formation, bone remodeling, dental follicle, and periodontal ligament. So in the root formation, I already told you the tissue beneath the growing root resists the apical movement of the developing root, and this resistance results in the occlusal movement of the tooth crown as and when the root lengthens. I've already described that to you. But there were not enough proof to show this because even rootless tooth still managed to erupt, and it is mostly seen in rodent incisors and guinea pig molars. So, root formation is more of an accommodation rather than an important cause of tooth eruption. This was one case which was seen in a boy of 7 year old, where you can see that the premolar, which has not completed its root formation, has erupted into the oral cavity and is quite stable. It is not even showing any mobility. If you're interested to look at this case, I will put the link in the description box below. Bone remodeling is also another important factor which occurs during tooth eruption. Like I said, osteoblasts and osteoclasts are responsible for this. When you wire down a tooth gum, still an eruptive pathway was formed, and osteoclasts still widened the gubernacular canal. So that's what led them to think that the bone remodeling has an important role in the eruption. But it still doesn't prove if bone remodeling plays a significant role or it is just during the process. Dental follicle is thought to have a major role compared to all other factors which we're going to discuss today, because it's the dental follicle which sends signals and recruits the osteoclast and releases the factors which are responsible for widening of the gubernacular canal and ultimate eruption of the tooth. So that's why dental follicle is thought to initiate the entire eruption. And the proof is that the tooth eruption is delayed or absent in animal models and human diseases that cause a defect in osteoclast differentiation. And because the osteoclasts are recruited by sending the signal and chemoattractant by dental follicle, it is thought to have the most important role. The periodontal ligament, again, I already described to you. It's because of the traction power or the myofibroblasts which are present, but presence of PDL does not always correlate with tooth eruption because a lot of impacted teeth do have periodontal ligament, but they don't really erupt into the oral cavity. Transforming growth factor alpha and epidermal growth factor are supposed to increase in incisor during the incisor eruption, and during the molar eruption, it's the colony stimulating factor 1 which increases. Active eruption was what we discussed till now, that is the bodily movement of the tooth from the jaw to its functional position within the oral cavity, whereas passive eruption is lengthening of the crown either due to loss of attachment or because of the recession of the gingiva. As you can see here, the patient had quite small sized teeth, but due to recession they have become enlarged. But this could also be a result of cosmetic process. The patient is not happy with the length of his crown. We can use laser, and you can increase the length of the crown by exposing some of that anatomic crown which is hiding underneath that gingiva. So, in summary, the tooth is within the jaw. There is a pre eruptive movement where it moves within the jaw and comes into its eruptive position. The dental follicle fuses to the oral epithelium and becomes a single layer. Hydrolytic enzymes are released from macrophages, which lyses this thin layer of epithelium. The tooth penetrates into the oral cavity and reaches its functional position or occlusal contact with the opposing tooth. Many factors are responsible, like root formation, periodontal ligament, bone remodeling, and dental follicle is thought to have the most important role because it's the dental follicle which recruits the osteoclasts, which remodels the bone and facilitates the eruption. Whatever I described is put as description here. Whenever the tooth falls, there is hemorrhage, but when the tooth erupts, there is no hemorrhage because there is no connective tissue around it. When it breaks into the oral cavity, it is just the epithelium on top of it. That is the reason why there is no bleeding when the tooth erupts into the oral cavity. So, the four theories, just to recollect: the root formation, bone remodeling, dental follicle, and periodontal ligament. Periodontal ligament has contractile properties, hence it helps. Bone remodeling, because osteoclasts are supposed to have an important role, but it's actually the dental follicle which has the major role because it recruits the osteoclast and sends its signal and chemoattractant so that osteoclasts can do their function. And root formation helps in certain way because of the pressure it negative pressure it creates against the bone underneath. All primary teeth erupt by the age of 2.5 years, and by 4 years the root formation is completed. By 6 months is the first deciduous tooth which erupts into the oral cavity. These are my references. I hope you liked my presentation today. It's slightly different from the pathology presentation because it's normal, it is histology. If you like my presentation, please like and subscribe to my channel and share it with your friends, please, and tell them how great a channel it is. And please go to my website. You will find plenty such MCQs to practice and get better at your game. Thank you and keep smiling.